All right. Hi, everyone. Thanks for joining us for another episode of Ask the Howlers. It is our cybersecurity expert roundtable. We will follow the typical agenda. We will start out with just talking about having each of the panelists will actually bring an article to talk about today with the different panelists. And then what we'll do is round out with any Q&A. So in this case, I do want to do some introductions. For those of you that don't know, my name is Stacia Tympanick. I am a solution engineer here with VMware Carbon Black. I've been with the company coming up on 6 years. So I will be the host of today's show. I'm going to turn it over to Trent.
Thank you, Stacia. I'm Trent Greenwood. I am a solution engineering manager. I've been with Carbon Black for just over 4 years now. Prior to that, I was with RSA doing a variety of different, managing a security group over there as well. So with that, I will kick it over to Charles.
I'm Charles Bouley. I am the principal security architect for Lifespan. We are a healthcare provider in Rhode Island. Before that, I did a lot of defense work, cyber defense, systems administration. I'm also a cyber warfare officer in the Army Reserves. I'll kick it over to Ryan.
Thank you, Charles. Ryan Manni, Manager of Security Operations at Howlers. We are a medical device manufacturer based out of Marlborough, Mass. And I've been here almost 9 years.
Awesome. All right, guys. So we are going to kick it off with the first article, which comes from the Health Sector Cybersecurity Coordination Center, and it's titled APT 41, Citrix and Zoho Attacks on Healthcare. So let's kick things off. Why did you bring this article up? What did you want to get out of this article altogether?
So this one is the one I selected, and I wanted to bring this article up more to bring the question to the group of why do you think healthcare is being targeted right now? I think some of the answers are obvious, and I touch on that in the discussion points, but wanted to get an overall answer to that, and then kind of segue that conversation into not so much the technical detail of what this APT is doing, but what can be done to help prevent it regardless of what technical, for example, they're using Citrix to get their foot in the door, but what can you do to make sure that you're still secure if that were to happen? So why do you think healthcare is being targeted during a global pandemic? Kind of shine a light on that, and then what we think we can do to help mitigate that.
Well, I know that Trent had actually brought an article in that was dated back in March, right, Trent? That it was kind of at first the attackers came out and said, you know, we're going to take it easy on healthcare, and you know, we're going to give them a break. And so, Trent, I'm curious to hear your thoughts. Like, why do you think that they even came out with something like that if we're continuing to see healthcare get smashed?
Well, I mean, I think it's a couple things, right? I mean, I think you probably have some folks that adhered to that, and others that just didn't, right? I mean, at the end of the day, this is cybercrime, and most criminals are opportunistic in nature. So what easier way than take advantage of what is going on right now? I mean, this really, one of the things that this has caused is a complete shift in the way that we think about things and the way that we go about our day to day. And it's really, I hesitate to say it, but it's kind of made an easier, a easy target even easier with the environment that we're now. All of a sudden, you know, this shift to work from home, the shift of everyone is paying attention and distracted with this the other things going on around them. And again, it goes back to criminals being opportunistic. And that's all that this is. This is their chance for a big land grab and an easy target. So why not take it, right? That's kind of that's my viewpoint on it.
The viewpoint that I didn't have initially, but after thinking about it more, kind of came into effect here. And I know we want to shy away from actual names and organizations, but we had one of our partners have a ransomware attack. And one of the things you think about is, because the hospitals are such a critical resource right now during the pandemic, they need to be up and running. They need to be providing their service no matter what. So if what you're delivering as the attacker is a ransomware attack that you're actually going to deliver on if they pay the ransom, is almost a no-brainer if you are the hospital. So if you get rocked by ransomware and they say, give us, you know, $500,000, $2 million, whatever it is, and you are a critical component to help treat this global pandemic, you're going to pay it. You're not going to take the time to sit back. What do the DR strategies look like? How do we do this? How do we do that? You can't provide care during that time. And I think that's what's really fueling a lot of this, is attackers know that if they target a ransom amount that is not too egregious, the hospital may just pay it just to keep moving, because they need operations up and running because of the pandemic. So I think that is unfortunate. It really highlights how horrible these people are to kind of capitalize on that. That was my take on it.
And so one thing that makes me think of is, I used to work as a network admin at a hospital, and you know, we were a small, you know, nonprofit in a small city, and you know, that was 10 years ago. But I don't think in the past 10 years, staffing levels and security has taken a large enough leap. And you know, I go back to, you know, we had DR policies in place that said, if the system goes down, you go back to paper. And I don't think enough hospitals train on that or have it ready. So, of course, if you get hit with ransomware or any other attack, your physicians and nurses are in a panic, which puts other staff in a panic, which then has, you know, everyone hovering over the IT and security folks to just fix it, whatever it costs. And so you lead to, hey, we're going to pay the ransomware, whether it's 2 million or not, because patient lives are on the table.
Right.
And if they actually had, you know, calmer people that have trained through incidents, they might be able to get by with going to paper and not having to resort to that. You know, if their systems were isolated, the ones treating the patients, you know, the PC is getting ransomware, that's fine. But if your intubator, you know, that's, well, that shouldn't get ransomware. If it does, that's a whole different problem.
Well, and you got to think too, like, I think all of us, I remember back in March saying, okay, Italy, it took 4 months. So I was like, okay, I said July, and people were like, you're crazy, Stacia. Like, this will be way over by July. Like, we won't have problems. And now look at it. So you also have to consider, did their mindset change where they thought, okay, this is going to look good for us for all of 4 weeks that we have to kind of take it easy. And now we're in month 5 and it's like, okay, 5, 6, like, we can't let our business go on that long without hitting someone. So I wonder if that plays in too. And when's a good time to train people in a hospital? Like, I know we'll talk about this a little bit later, but like, when can you really sit down with these people who are already overworked and are working long hours and are under a very high stress job to say, okay, so if this were to happen, this is how we're going to train for this or prepare you for this. That just seems to me like a tall order, and why I feel like healthcare really has a hard time buying into the culture of security first. It's a very user first culture just by the nature of it. That's not as true.
Yeah, and I mean, it's also, and you also have to remember that within healthcare, right, is time can cost lives. It really is kind of a life or death sort of situation, and you know, the longer it takes for a doctor to log into a system, the longer it takes for somebody to access a patient's files, you know, that could, those minutes, those seconds could be the determining factor on whether or not that patient, you know, makes it or not. It's kind of a, you know, dark way to think about things, but that's the reality of it. And so a lot of times, they just don't, they may not realize that, or again, have the time for it. And I think that you bring up a good point around, yes, we made kind of this honor among thieves agreement that these people are hands off, but then as soon as one person kind of breaks that agreement, at that point, then the others in that group begin to think, oh, wow, well, these folks are capitalizing on it. We're sitting here on the sidelines. Maybe we should jump in and join the game as well. And so it's like once the floodgate opens, at that point, it's no hold bar. I mean, it goes back to a truce between warring factions. As soon as one entity within that on either side kind of breaks that truce, at that point it's just game over, right? And so all's fair.
Yeah, absolutely.
So one thing that I've just been thinking about is, they might have made that agreement in March, and that was, way back when the hospitals were struggling. As the different countries got their hospitals better under control, and different governments start, giving out funding to these hospitals, is that a motivator for them to then, attack a healthcare facility because they know they just got handed a bunch of cash and haven't spent it yet?
Yeah, that's a good point. I mean, you see the government agency, the CISA, stepping in and trying to help assist a lot of these organizations. And you see things like CARES funding going out there that has to be used by December of this year. So, I mean, it's kind of like, okay, well, now that you have the support you need, now we can can go back to the normal day to day.
Yeah.
So, Charlie, as far as like the actual techniques that we see being utilized, looks like, what I'm seeing in general through COVID is I'm not seeing really new types of attacks as far as what's being leveraged, like RDP. I mean, that's nothing new to us, but I'm just seeing the volume of attacks increase. So I guess from a healthcare perspective, are people looking to just eliminate if RDP doesn't need to be externally facing? Are you just trying to lock it down? Are you, what are people doing about RDP? Because it seems like it's just like that revolving door that attackers keep utilizing to get some persistence in the environment.
That has been a topic of conversation with us too, is, why are we using it? What alternative solutions do we have? If we have other software distribution systems that have a remote support, or how does a service desk person remote into a workstation? Is that more secure than remote desktop? Can we put MFA on a remote desktop internally? Does that make sense to do that? It does if someone's trying to pivot around. So that's definitely a topic of conversation. Where if something is being leveraged over and over again, you just keep reading these reports like this person got attacked, this organization got attacked, and it was this one technology over and over again. We have been having the conversation like, do we even need that? Or is there a more secure alternative that the business now, because of what's going on, is willing to fund? Where if it wasn't being attacked so much, you would say, oh, I want to replace RDP with something more secure. And we go, we don't need to do that. It's free with Windows. But now that it's being exploited so much, now the conversation is what's it going to cost and what's the benefit. So we are definitely seeing a lot of that on our end.
Yeah, I've seen quite a lot of uptick in the marketing and adoption of the zero trust models, and the way that you use some of those newer private access that are not standard VPNs. But I think I saw this before at RSA presentation, and I've seen it numerous times. If you simply just put MFA in place, you are going to stop a lot of the opportunistic attacks. You're never going to stop someone that's determined just through MFA, but like we've been saying, a lot of these are opportunistic. If you have just something that deters them, they're going to move on to someone that doesn't have it. So you're
Right.
going to protect your facility. And yeah, the hospital down the road might get hit, but you've at least protected yours. And then, if every facility starts doing this, then, we make a dent in the attacks.
Yeah, and it's still I feel like a top-down initiative that has to happen. We did a study, our threat report said something like only 33% of organizations had MFA implemented in healthcare. But then when I did a couple panels, I'd done 3, and I would say about 80-90% of the people on the panels had MFA implemented. So that made me feel a lot better. Like if you were going to rip off a Band-Aid during COVID, one of them could be, let's get MFA implemented. That's what it seems like. It seems like that's starting to become a baseline priority for organizations.
Yeah, and again, I would, when it comes to like MFA, I mean, that's one of those things that drawing off my past experience in dealing with healthcare, right? MFA is fantastic, right? But when you introduce it into the healthcare where somebody has to have a device on them, whether it's a mobile token, whether it's something off a keychain or something like that, that introduces that time lag again, right? And so now all of a sudden, you have this to deal with, and if it doesn't get set up properly, right? And let's say that it's 3 strikes and you're out for 10 minutes, and somebody is in a hurry and they fat finger it three times, all of a sudden now their account's locked out, right?
Yep.
So while it's great, I mean, I totally understand why healthcare organizations have been slow to adopt it. But yeah, I mean, any little thing that you can do to slow down an attacker and cause them to move to the next easier target is definitely worth it.
And one thing we've seen too, just operational procedures that won't allow it. A lot of nurses can't have their phones where there's patient care. My mom is a nurse at one of our hospitals, so I actually use her to gain a lot of that information. Like, oh, we're thinking about putting this control in, or this is going to come down the pipeline. She's like, she's just a registered nurse, and she'll say things like, well, I can't even do that, and it's why not. And then she explains it. We go to the business is like, yeah, we can't do that because we can't have a phone with the patient for this specific example. Or they badge in with a physical badge to tap into the computer, and then it logs them out of the other computer they were just logged into in the same emergency room, because we only have you being able to log into one computer at a time. That's really something that's going to mess doctors up as well. So from a security standpoint, you look at it and you're like, yeah, they should only have one computer and they should have MFA, and you're all right. I mean, when you start applying that to healthcare, it all kind of just falls apart in some sense, and that's what makes it so appealing to attack, I believe.
Yeah, at least the good thing is you see it being utilized more with consumer products, whether it's Gmail or Facebook, or a lot of the social media are now adopting it. So at least the user experience concern should come down a little bit, because some people are enabling it for their standard. I even see people fight like LinkedIn should have 2-factor. So I mean, it does seem like it's coming more to the consumer market to help with the user experience side, if you will. But those are great points, Charlie. Like, I didn't even think of those, but that's like, yeah, we can't even do that. It's just not an option. How do you get around that? I don't know. All right, so we're gonna move on. This one's really a positive one. 230 million U.S. healthcare records lost or stolen between 2009 to 2019, study by Privacy Affairs. So Ryan, tell us, why'd you bring it? What's the deal?
Yeah, I mean, I think I brought this up because, whether it's healthcare, or you look at, all the other breaches that have been happening, in the past 10 years, no one's holding anyone accountable. You obviously see, some people go testify before Congress, but then, they still get their bonus at the end of the year and their stock options. So I think we as a security industry, we need to start trying to advocate for holding these companies accountable, whether we're working at them or not. And as soon as we start seeing a financial incentive to actually implement security correctly and not just do a compliance check in the box, then you're going to start seeing companies hiring more people to do the right thing. You're going to see it's going to shift the dynamic. So instead of, oh, I'm sorry that we had a breach, we take security seriously, that doesn't happen anymore, and they're actually taking security seriously from the get-go. And I know there's a lot of smaller companies that's not as easy, because when you're a small startup or an SMB, you know, the pizza place down the road can't hire a security professional. But if we as a security industry, if we, you know, maybe we start some nonprofits that do something to help smaller companies and really push the issue, because security is not going anywhere, and neither are the hackers. So we need to make a change. And you know, having records stolen at this astronomical rate, pretty soon everyone's health information and social security numbers, it's all going to be public info. And at that point, I mean, I guess there's no more hacks because there's nothing to steal, but I think we should try and avoid that.
And what do you think, like, as far as from an InfoSec industry, what can we be doing to help, whether it's vendors, whether it's people who are actually in the roles that we're serving? I mean, what can we be doing better?
I mean, I think that the biggest thing that I've seen as part of a blue team, you know, a defender, is we all work for companies that, you know, we have our stockholders, we have our own obligations to the company. We can't divulge certain things that happen, whether they were, you know, a breach event or just malicious activity, because the headlines don't differentiate between the two. You know, if you say, oh, I had this threat actor on my network, but we evicted them, your stock's going to plummet, because that's going to be in the news as this company was breached. Even though you didn't have a breach event, you did have someone on your network. But that's, you know, I think we all know that malware gets on systems. These things happen. It's how you respond and how you evict the threat actors that matters, and stop them from getting their ultimate goal, which is, you know, in some companies it's PII, PHI. For my company, it's our intellectual property. That's really what we're defending. But if we're not able to share that data between other groups like us, or even with, you know, Intel researchers, then we're all kind of working in a silo, and the attackers are all working together. You know, whether they share willingly or pay each other for information, they get that information out there, and they're working a lot more coordinated than the defenders are.
It's kind of an interesting point, because I feel like this comes up kind of frequently, right? When, even if you look at like the ISAC groups, like, how do we get enough data where there's good fidelity and integrity of the IOCs without sharing too much? I think it's a battle that the threat intel industry has been facing for a while, and those aren't cheap organizations to be a part of. I think they're great, but I was just up on an ISAC the other day looking at the memberships, and it's not, you know, it's not cheap at all. And so the question is, how do we make sure that we're getting, you know, there's a million IOCs we could be tracking or trying to follow or block or alert on. Like, how do we know which ones are compelling to us in the industry we're in and the size of our company? I just think it's something we've been struggling with.
Yeah, we definitely had that problem when there was the recent breach I mentioned earlier, where we were trying to get our hands on what the IOC could have been, how it got in, what kind of ransomware variant, anything. We got nothing, because of what Ryan had mentioned. Like, they can't divulge what they A, don't know, or B, can't. So it is a problem. So it just creates panic everywhere else, because you're not sure where to focus your efforts. You should be trying to focus everywhere, but everybody knows that's impossible.
Yeah, and I would say, I mean, some of this goes back to, just companies not wanting to be forthright with what happened. And some of it goes back to, and there's been some recent legal things around like the Capital One, breach that happened where legally they had to disclose what their they had somebody in doing pen testing and things of that nature, and it was before it, and it came out that they had to actually disclose, what was discovered, right? So you still have companies that won't be forthright with what happened to them, and that makes it difficult, right? If my house has gotten broken into and you're my next door neighbor, and you come over and you're like, hey, what happened? And I'm like, oh, somebody broke in. Oh, how did it happen? Oh, well, I'm not going to tell you. Okay, well, thanks, right? I mean, I don't know what I'm supposed to do, and now I kind of live in this state of either paranoia or ignorance, because I'm just going to think that everything is okay because my people are telling me to about it. And I think Ryan hit on something that is really kind of key as well, is accountability, right? When are folks going to start being held accountable? A lot of times an organization will have a large breach, and typically there's no what I would call real public shaming, right? The CISO or the people in charge, they may retire, but behind the scenes, all of a sudden they'll pop up somewhere else. And, oh, by the way, their retirement package was a pretty sweet deal. Whenever you start looking at, if you dig in, particularly if it's a public company, and you can go and look at it, their financial disclosure statements that they have to do with earning reports and such, you'll see, oh, such and such walked away after being in charge or being on watch during a breach, and they walked away with multi-millions of dollars as part of their package, right? And that's just unacceptable. I mean, it's unacceptable. And until those people are really kind of held accountable, and it's like, yeah, sorry, you're not getting anything, which, oh, by the way, my guess is in a lot of those instances, the SecOps teams are probably gutted, and they got absolutely zero severance or anything. It was, thank you for your service. Here's a month's worth of pay until you find something else. And it's just, it kind of stinks, to put it mildly. But again, I don't know that until there's some radical, which I say radical, to me, it's more common sense, until there's some of that accountability that is put out there, I don't know that people are going to be forthright all the time and share. And I don't mean to damn all organizations, because there are those that are, do take and disclose, and there are organizations where they will take an information share to help others. But I think in a lot of, there's still more times where their information could be helpful if they would share it, and it's not shared, than there really needs to be. Because at the end of the day, we're all trying to do the best for our consumers and our people, and helping others out is just kind of being a good citizen.
Well, and just to play devil's advocate, right? Just for fun, if you put in legislation that will hold people accountable, right? That is hey, we're going to lay down the law. Do then people become even closer to the chest, right? Because now they're like, well, we don't want it to get out, because then this is going to XYZ is going to happen. I don't know, right? It's, how do we do both of those things and do them well?
right? Because what we have to worry about, or in most healthcare organizations, is the Office of Civil Rights will come out and, you know, they'll do an investigation. And if they don't find everything to be to their liking, you'll get a fine. And to touch on what was already said, I mean, it's usually the organization and ultimately the customer or patient who is the most affected and adversely affected. I mean, if the OCR comes in and they say, oh, you didn't do what you were supposed to do your due diligence to protect this patient information, so that's why this breach happened, here's your giant fine. There could be some team cycling, there could be a giant fine for the organization, but you know, if there's senior leadership that stay in there or move on, that's, you know, it's putting personal ownership on that because they're the person who's at the, you know, the captain of that ship. So I think there's some merit to that idea. It would make you care way more about what you were doing in your day-to-day operations. If you knew that at any point something could happen, you may personally be on the hook for that. And I'm not saying fine them, you know, a substantial amount of money. I'm just saying I didn't hate the idea of public shaming. That was good. Instead of letting someone fade out. And you see that happening with much larger organizations where it's like, oh, you know, Target had a breach, and then someone steps down, and then a year later they step up somewhere else. That is a little disgusting.
Well, and part of me thinks, though, again, to play devil's advocate, like, who better to have in a role than someone that's gone through a breach, right?
Yeah.
So, like, you don't, and because they didn't disclose how everything went, because that's so close to the chest, they just said, I was in this role during the breach, I went through it, I know, you know, or maybe, hey, I know all the things we did well and things we could have improved on, and I could bring that to this organization. So that's also something to consider.
And to completely negate what I just said, you know, it's a constant cat and mouse game. They have to be right once, we have to be right every time. So to then blame one person for not being right every time doesn't seem fair. It's obviously the opposite of what I said, but there's no right answer here, I don't think.
Mm-hmm.
No, and you're right. I mean, it's very complicated. It is very complicated. It's easy to kind of sit back and kind of throw this stuff out, but you're absolutely right. You know, they only have to be, you know, the bad guys only have to get it right one time. You know, the other teams have to get it. I think it's in those areas. I think there's two things. One, I think it is how sensitive is the data that left, which can be subjective. But then is there this pattern? Can a pattern be shown of negligence where they had pen testing come in, they did red team, blue team exercises, and they knew about their holes, and they never really did anything to address it? So I think that there's definitely some subtleties there that go into that. You can't just damn the entire organization because maybe they slipped up a time. Right. But if it is one of these things where, yeah, we knew that we had unpatched systems for a year and we just didn't patch them because we couldn't, it was too hard or too difficult, or it was going to cost us you know, $500,000 to bring everything up to compliance.
Absolutely.
Yeah.
Absolutely.
That's a big thing on the government side too, is cost cannot be the driving factor not to do something. So if you had that exact same scenario on the DoD side and you said, we have this project, we want to put this vehicle in the water, we want to do this type of work, but we have this vulnerability here, but it's going to cost us $1 million to fix that. The project management would come back and say, then you can't do what you need to do. You can't test it. You can't put it in the water, fix it, find the funding, do what you need to do, or this whole thing's going to die. It's pretty black and white on that side, which has its benefits and, you know, detractors, but being able to make that call, I think, is hard when you're in the private industry and there's way more business and organization decisions being fueled by that.
Oh, sure.
All right, guys. Well, we have time for our bonus question, which is always, just to wrap it up, something a little bit more on the lighter side. So it's a yes or no question. Does Carol Baskin win Dancing with the Stars? Yes or no? Ryan, you start.
I'm going to say no. I still don't, never seen that show, but I'm going to say no.
Wow, little faith, little faith. Well, Nellie's also competing. So, I mean,
Yeah, exactly.
that's going to be, yeah, exactly. All right, Charlie, what do you think?
It's the only show I watch. I have no idea. I'm going to go with a hard no.
Oh, come on, Trent.
No, I've got to agree with Ryan and Charles. This is unanimous. Hard no here, and a hard pass on ever really watching that show.
All right, all right, all right. Well, I'll tell you what. I will say yes, and if she does win, then I want a bottle of Pinot Noir sent to my apartment for getting that right. So this is recorded, so we have it on tape.
That is a deal. That is a deal.
All right, guys. Well, thanks for joining us today. For everyone else that's out there, please join us for our next episode, which is going to focus on the top VMworld security sessions that were presented. Please sign up if you haven't yet for VMworld. It's going to be a good time. I am doing a VMworld throwdown session that I'm pretty excited about, so make sure to catch that. Otherwise, everyone, we will catch you on the flip side. Thanks, guys.